Okay, very good. We're on one, we're on two. Hello everyone, Dr. Rich Castellano here. We are here today with Heather. Thank you so much, Heather, for allowing us to share your video. We're going to be doing some facial fillers. We're doing the Bellafill and some Bellatero, and we're on that one too. Okay, thank you so much. And so we're going to go through what we've talked about a little bit with Heather. Heather came to one of our seminars, and your husband's interested in doing a treatment as well. We're going to show you her pictures. Heather, of course, looks very natural. She's not done a treatment with us before. We're going to do some fillers to fill the volume. It helps us look younger with no surgery, no physical downtime. We might get bruising 4 to 7 days. So those are the before, and you see the befores right here, and she's diligently using her ice, and the ice certainly helps. Excuse me, Nina. Oh, here we go. You can see that on there. Yeah. And ice helps to make the blood vessels shrink and less bruising, and it also numbs a tiny bit for the skin. So the first thing that I do is I like to ask Heather, so I'll have you set the ice down. So Heather, I like to hear it in your words where your focus is. That way I know we're addressing what's important to you.
Yeah, and like these lines here.
Through there,
right,
okay. And then the lips, we're going to do some lip plumping there as well.
Uh-huh.
So let me mark those areas out. So what I tell patients is the areas that I'm going to mark, that's what we're going to treat. And if I don't mark it, then we're not going to treat it. So we're going to fill as many of the creases as we can. I never use the words gone, take away, get rid of, but we do as much as we can. I'll zoom in just a little bit here. There we go. And Charlene, do you mind zooming in a little bit on those? Thank you so much. Charlene can do it while Ian's got it. So I'm filling in through these areas. Now, as we talked about, if you do a little tightening, that can help. But the beauty of the fillers, there's no downtime. So 4 categories we address. If we sag, we tighten. If we lose volume, we fill. If we get sun damage to the skin, wrinkles and sunspots, we can polish and repair the skin. And the 4th category outshines everything else. That's our behavior. Make a big smile for me, big smile. See, that's half of a smile, but see how it plumps the cheeks there, okay? Now relax the mirror for just one moment. So I want to show on the camera, make a big smile, big smile, big smile. So that looks good, that's half of a smile, and that's okay. Now have a look here. So hold that for me. Now, to complement, to offset that, I do like to recommend the temple and a little bit in the brow. We can do, we just follow where you see a little bit, maybe some hollow, okay? We know we lose bone in the bony prominences, brow, cheek, back of the jaw, chin, and we hollow a bit in the temple. So we'll do around the mouth, we'll do in the cheek hollow, submalar region. We'll do a little bit through here, top, the orbital rim, top of the cheek, back of the jawline on both sides. Thank you all for joining in. I'm Dr. Rich Castellano. For those of you just joining, we're in Tampa, Florida, and in the Villages, Florida. And my team have everything set up perfectly for me. Thank you so much to Charlene and Nina. We got such a great team here. We have a lot of fun in the office because we have the best patients. We're so proud of our patients. So, Heather, these are the areas we're going to treat. I'm also going to numb the lips because we're going to plump. I'm going to use the Bellafill for these areas. I'm going to use the Bellatero for the fine creases. Were there any other areas that you wanted to address?
No, you're going to fill them in a little bit.
I'm going to fill that in.
The hollow and the
correct.
Around here.
We'll do as much as we can with what we're doing today. If we need to come back another day, that's better than going too far, but we'll do as much as we can, and you will look natural. Yes, go ahead.
What are you doing up there?
So in the brow, and so now is our chance, now's our opportunity to decide what we want to do. I normally recommend to do a bit in the brow because do you see how we get a little bit of a hollow there on the top of the eye? I fill those areas in, correct, correct, and it gives us a little bit of a lift for the brow. Now, if you don't want that area, we don't have to do it. How do you feel about this area across through here? Because normally I'll do it with the temple, and I do recommend it, but if you want to bypass it, we don't have to treat there. Do you have a preference?
Well, I can't see anything wrong with this. Like, there's my bone.
So
what would that do? Like,
so when we're younger, that's a very good question. When we're younger, we're much more full across through this area, and so I'm just putting things back where they already were. So here's how we make the decision. If you say you'd like to go on my recommendation, I would recommend it. If you tell me, hey, I like the way it is, let's leave it be, I'll completely leave it alone, but I do think it will help create more of a youthful appearance through that area.
Oh, you're the doctor. You're not.
Okay. I do
I have
think
very deep set eyes anyway.
It helps to offset that. As we get older, the more deep set and more hollow our eyes are, it makes us look older. So this is just to turn things back a little bit. So if that's okay, I do recommend a little bit in there. Not too much, but just enough. So these are the areas we're going to treat. Are there any other areas that you'd like to address?
Oh, that's all.
Okay, very good. So go ahead, keep doing your eyes. I'm going to do a little bit of the cleanse, and then we're going to do some of the...
I'm going to wash off all these marks.
That's okay. No, I know where they are. That's the marks are our way to communicate to each other what we're doing. I'm going to do some additional cleanse, and I know the areas we need to treat, and Charlene has everything set up perfectly for us.
It's not cold anymore anyway.
So I use the numbing medicine. It's lidocaine, 1% with 1 to 100,000 epinephrine. And thank you everyone for watching and sharing. We've had hundreds of thousands of live views from all over the world. So this is the HibaCleanse that we use. Hey, there's Gabe Frasca. Good to see you. And Dave, good to see you as well. So this is the HibaCleanse. Rest your head all the way back for me, dear. So we do the cleanse through this area, right? And there's certain little areas that I will insert the cannula. Those are the areas that you want to be the most clean. I also use the alcohol cleanse. People talk about the cannulas in between. We do an alcohol cleanse of the cannulas in between injections, so we're always trying to be very fastidious about those things. It is rare that you would have an infection from a filler. Those can be treated, but you want to be proactive. That's why I give my cell phone to all my patients so that they can call me at any time, but that is rare that someone would have that type of an issue. Now, for the numbing, when I do the lips, of course the lips are more sensitive. I use the 1% lidocaine and the buzzer device. Hello, Rosabelle, good to see you. So what I'm going to do is I turn the buzzer on now. I'm going to lift up your lip here, and then you count across 1, 2, 3, 4 in between the 4th and 5th tooth. Pinch on 3, 1, 2, 3, pinch. Feel a little bit of a pinch there?
No.
A little bit of numbing. And a little pinch, 1, 2, 3, pinch. Little pinch there, not too bad?
Good.
That's good, okay, all right. We always want to make sure our patients are comfortable, so they'll feel little pinches and we'll numb as best we can. So we're doing infraorbital nerve block here, which helps with the lip filler. We're going to use Belotero. I'll use about 1 cc, maybe 1.5 cc's, and I will also go medial towards the nose. It's a sensitive area, but when I do a little extra injection, I just find it numbs the lip a little more completely. So we're looking for that infraorbital nerve, infraorbital foramen. Pinch on 3 here, 1, 2, 3, pinch. Mandibular nerve block, about 0.5 cc, almost a full cc. And I'll come back and test that later. Heather, how are you doing, dear?
Good. Good.
Everything's looking good. Now afterwards, I'm going to lift your lip here. Pinch on 3 here, 1, 2, 3, pinch. So what happens is the lips make it difficult. You'll sound like you've been to the dentist office. Fluff, fluff, fluff. So that goes away after about 30 minutes, but I like to make it as comfortable as possible for our patients. We're very proud of our patients. We mentioned our 4 categories: pinch, tightening, volume, skin, and then behavior. And there are 4 principles that you must adhere to for a good cosmetic treatment. Number 1, you must look natural. And Heather will pass the grocery store test today, especially once the numbing medicine settles from the lips. Number 2, safety. Number 3, prevention. Number 4, get as much improvement as possible. So your lips will feel a little goofy. Now Heather, do you feel a little bit of a pinch here, a little bit, or not too much? How about here, a little pinch, a little bit?
No.
Little, and how about here, a little pinch over here, a little bit? Not really? Little bit. Okay, good. So this I find, some people say, oh my goodness, it's so painful. Do you feel a little bit of a pinch here? Not too bad? Some say it's so painful to inject in the lips, but what I've just done, Heather, how was that so far, dear?
Good.
So that's really that's the numbing I like to do for the lips. Now I'm going to numb in these other areas where we're going to fill through here. Pinch on 3, 1, 2, 3, pinch. And I'm not in a hurry. If you need a break, you let me know. Everything's looking good. Thank you all for watching. Hello Irene, hello Rosabelle, thank you for watching. Very good. Pinch. So we numb through these areas. Rarely, you feel a pinch, rarely I'll have a patient that requires some relaxing medicine. Pinch before they do fillers. If you have that, you just need a driver. But some people are more sensitive. So that's a little tender area. Back of the jaw, 1, 2, 3, pinch. So the little pinches, 1, 2, 3, pinch. And then after that, the rest is pretty straightforward. 1, 2, 3, pinch. Heather, how are you doing, dear?
Good.
You're tough. And it's important when you talk to the patient, they feel so much more comfortable. So you want to make sure you're talking to the patient. Let me turn your head this way just a little bit. Buzz and then pinch. 1, 2, 3, pinch. So thank you all for watching. We're very proud to be the #1 Bellafill injector in the United States. We do a lot of that filler. I'll do about 200 syringes, pinch, 1, 2, 3, pinch, of filler every month. I use all of the fillers, hyaluronic acid, Radiesse, calcium hydroxylapatite, Sculptra, and Bellafill. Pinch on 3, 1, 2, 3, pinch. I always recommend our patients see the dermatologist once or twice a year living in Florida. Pinch.
What are you doing to her today?
We're doing facial fillers, we're doing Bellafill, and we're doing some of the Bellatero for the lip. Pinch. Heather, how are you doing, dear?
Good.
1, 2, 3, pinch. We are also excited to be training our doctors in how to run a practice like we do. Practice Profitability MD. We're starting our class coming up soon in the next few weeks. So if you're a physician or a student and want to learn more about how to run the business, look us up, Practice Profitability MD. Okay, so what we're going to do is I'm going to start with the Bellafill, and we're starting in the areas around the mouth. So this is the Bellafill, okay, and this is when I'm doing it in the skin, that's just a little 1/2-inch needle through this area. So I like to pre-mix my Bellafill. Let me turn your head this way just a bit. You have a good close-up of that, you know. So I find the crease. This is intradermal. You can almost see the skin reinflate and plump up. So with the needle, it goes right through, and then I like to use the little shiver technique because it gives you a fine amount of product that you are releasing. You feel a little bit of a pinch there, or not too bad, Heather?
It's okay.
It's okay? Okay.
Yeah, it's good.
You feel pinch, 1, 2, 3, pinch. So I tell patients if they need a break to let us know. And even when we make the smile lines, pinch, you will form the crease here. So you never get rid of these areas 100%, but you make them as good as you can. So that's right, and I do a little bit of withdrawal in that area. I like the shiver technique, and we're going to be talking about that in Phoenix later at AAFPRS meeting, and I'll probably discuss it a little bit in Miami at the Global Aesthetics Conference, where I'm speaking at both of those conferences. So just a simple subcutaneous injection, very small amount, a little pinch through here, 1, 2, 3, pinch, a little more tender area. And you can even stay in one area as you're injecting, and I like to do a firm massage because it does kind of reinflate through the dermis as you inject. So I mix my Bellafill with additional, or my team does, with lidocaine because it makes it a little less viscous, a little more dilute, and I think it's more difficult to create a bump when you are injecting with more dilute product. So little bits here and there, and you can already see how the creases start improving. Thank you for watching, thank you for sharing. I'll do just a little touch here. So that right there is 1 syringe, which is typical. I'll typically use 1 syringe around the nasolabial folds and then the ilolabial folds. Now I'm going to do that again on the other side.
I can't smile.
Yeah, your smile will be goofy because of the numbing medicine, but we promise. Yeah, we promise it'll come back. Let me turn your head this way. Heather, are you feeling any discomfort at all, dear?
No, no. I only felt that one up there.
Okay.
But not.
And try not to touch.
No, just a tinge.
Okay, try not to touch too. I promise I'll give you your face back, but try not to touch at this point. So you'll feel a little, might feel a little pinch here. So, and can we share with them how young you are, Heather?
Yeah.
Is it 73, dear? Is that?
Next month.
Next month. All right. So you are looking good. People are living so much longer today. Heather, can you tell us why was it that you wanted to do a cosmetic treatment?
Because I didn't like all the wrinkles.
Yes, simply put.
No, I exercise, I take care, I watch what I eat, and I don't know. Some people say it's vain, but I don't.
Well,
I did it for me,
that's
not for nobody else.
That's the right reason to do it. Vanity is if we use our appearance for negative reasons. We can use our appearance negatively to put other people down, or we put ourselves down. And that's what I call vanity. But if you use your appearance for positive reasons to inspire others or inspire yourself, there's a word for that, and that's called style. So it's okay to have your own personal style. And again, I'm using the shiver technique to just get little small amounts, and then I also make sure that it's moving through the needle. Can I get one more 27 in case I need that? Thank you. Just a little tiny bit left in those areas. Perfect. Change. And sometimes I'll change the needle as needed. Changing the needle as needed. Hello, Catherine. Hello, Irene. Thank you for joining in. So little pressure, just a tiny little bit. So now we've done one syringe here, one syringe here. So I'm going to move on and do a little bit around the cheek, and temple is coming up next. Very good. So when I inject in those areas, I just take the little 27 gauge, and I'm going to turn your head this way just a little bit, and then we like to wipe off these areas so we look as presentable as possible. Everything's looking good. Make a big smile for me. Your smile will feel goofy with the numbing medicine. You can relax, that's perfect. Okay? And so I'll do just a little bit under the cheek here. Do you feel a little pinch there?
No.
And how about here? Just a little bit of a pinch?
No.
So that's the insertion point where I'm going to place the cannula. Okay? So we lose volume in the cheek, and I'm just going to be doing a little bit. So I find the point where I made the insertion point, I insert the cannula. The twist technique, very important. Twist technique allows you to place the cannula as atraumatically as possible. Shiver technique allows a very small amount of the product to be dispersed across the subcutaneous region. Okay. Heather, how are you doing, dear?
Good.
You feel a little pinch or not too bad?
No.
We did a little bit of the numbing. So this is really how fillers should be. Not that difficult to do, little pinches. Rarely I have someone that needs a lot of numbing medicine, or they'll need relaxing medicine. Now I'm also going to do some under the cheek in this area. I'm going to make an insertion point there, because we talked about what we call the submalar hollow. Okay, you feel a little bit of a pinch here? Okay, that's the area, and you see the hollow that's there. So if you look at your photos when you're in your 20s or 30s, then you'll see how the volume changes. It becomes very evident that we lose that volume. I'm going to turn your head this way just a little bit. So I'm just putting things back where they belong. So twist technique, twist, 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 as atraumatically as possible. You advance the cannula. Shiver technique, you want to do small amounts over a very large area. That helps the product feel nice and uniform and even, and reduce the ability to form nodules. So I'm doing a little shiver technique as I'm injecting through here, and I'm pressing on the plunger with my pinky. So we never make things perfect. You want to make things better. Thank you for joining. Thank you for sharing. And please, lots of hearts and shares for Heather for being so generous to allow us to share. And we've had people from all across the world watch us. Hundreds of thousands of live views. Look us up at imagelift.com. People ask for price. You feel a little bit of a pinch there, Heather?
Mm-hmm.
Sorry about that, dear. How about now? A little pinch there?
No.
Not too bad? Okay. People ask about pricing. You can go to our website, imagelift.com/pricing, when you want to figure out what is right for you. I think it's misleading to do pricing without a consultation, but you can go to our site and at least get an idea, an estimate. Okay, now I'm going to turn your head this way. So we did a little bit of fill there. We're going to do a little bit more through here. And as you can see, through the entire process, she'll look natural. Sometimes you may get bruising. You can bruise for 4 to 7 days. Pinch. It's variable. We ask patients to stop blood thinners or anti-inflammatories. Very good. Thank you all for joining. If you're just now joining in, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon, doing a little twist technique. Very feather touch. Just a little feather touch is all you need to gently disperse the product. This is across the superior orbital rim, okay? Top of the cheek. I do blepharoplasty treatments all the time, so I obviously feel very comfortable with the eyelid anatomy, so we do a little bit through there, and then I find my insertion point where I did right in through here. Insert the cannula, twist, Heather, do you feel a little bit of a pinch here, dear? When
No.
you are very gentle with placement of the cannula, it really can almost be painless. Advancing that little, she felt the pinch there, and I can tell when she feels the pinch. I can feel or see her wince. So we try and make it as delicate as possible. Now, once I inject some of the product, there's lidocaine in it, and so that little pinch there, she feels that. Then that lidocaine makes it easier on subsequent passes. Everything's looking good. Thank you for joining in. We love having our doctors watching and learning from our technique and seeing what we do for our patients. Everybody is doing fillers nowadays, but just because they know how to do fillers does not mean that they're an expert. We're very proud to share and teach doctors from all across the country, even internationally, about our technique, pressure pinch. Now, once you do fillers long enough, everybody starts to say the same thing. They say, well, don't you have something that lasts longer? And we do. That's the long-term filler, the VelaFill. The collagen gets absorbed. Let me turn your head this way. The PMMA, if you read the FDA approval, it is non-absorbable. So that's where we're going to go in for the brow and in through here. And the PMMA has been safely used in the medical industry for over 50 years in orthopedics, ophthalmology, holding in heart valves. And so now, across the brow, I find my insertion point, insert the cannula, support the tissues with my fingers. Hello, thank you for tuning in. Using the twist technique to advance. Pressure pinch, pressure pinch. Do you feel a little bit of a pinch there? So little, and I can do a little bit of withdrawal. With the cannula, it is very difficult to get inside of a blood vessel. That's why I prefer to use the cannulas in these areas. How about there, Heather? Little pinch, not too bad?
No.
Very good. Everything's looking good. So just a little bit. When the temples, when the brow is hollow or it's deep set, sometimes you may need second or third session to really fill, but at least start with some. Do some. Each little bit makes a difference. It's better to come back another day and do more rather than go too far. So that's about 3.5 tenths of a cc, and then I will raise the brow up and massage. I can massage that up against the bone so that it's nice and flat and uniform. Now when you're injecting and it's numb here, the brow won't lift up until that numbness fades in about 30-45 minutes. Twist technique, twist, twist, twist. I'm in the subcutaneous region. I believe subcutaneous in the temple with the cannula is your safest way to inject. Pressure, you feel a little bit of a pinch there, dear?
Little.
So, and you can use hydrodissection. So I'm injecting some, and I can even see the tiny, tiny bulge of the product I'm injecting. Now I can press that around, and that actually opens up the pathway for the cannula to proceed. And it numbs. A little bit of a pinch there. Not too bad. Okay, that's good. Very good. Got the thumbs up. Thumbs up is good. She did not make the fist sign at us, so we know that that's good. If she makes a fist, then we have to talk with her. Everything's looking good, Heather. You doing all right? Little pinch there. So, twisting technique, hydrodissection, shiver technique, all make for a safe injection. Now, if you get a little collection of blood or fluid here, you can hold pressure and it goes down very quickly. Is it normal? Someone says embracing gray hair. It means wisdom. Sure, you can use your appearance however you want to. Some of us want to look older, some want to look younger. Bottom line is people treat us differently based on our appearance. They treat us differently based on how young or how old they think we are in our workplace and in our relationships. And the most important person who treats us differently based on our appearance is ourselves. And so my job, of course, I tell every patient, none of my treatments look as good as Mother Nature's free facelift when we smile. And Heather knows the power of smile. She's a great smiler. So beyond that, if they want to look younger, I can help them with the treatments that we do. Thank you. But if they want to look even younger than what we can achieve with the fillers, then you just have to act immature. Yes, there's a lot of truth there. Thank you so much. So as you can see, let me turn your head this way. We filled a little bit here. It's a little more hollow here on this side. So now we're going to make that even. We don't make it perfect. We just want to make it better. And so Heather will pass the grocery store test today. It's all about setting the right expectation. And we don't want to be too hard on ourselves. Let me turn your head this way. Because it's really fascinating how we never see ourselves the way that other people see us. There's a physical reason for that. when we look at other people, we tend to give them a little facial expression. It's just natural to give facial expression. When we look at ourselves in the mirror, we go flat like a stone. Heather, how are you doing? You feel a little pressure pinch here? Doing good, little pinch. And so if you go flat to other people, they think you're mad at them. It's rude to be flat with other people. You felt a little pinch there. And so I don't recommend being flat with ourselves. And when we're flat in the mirror with ourselves, that's the perfect formula for feeling bad about yourself. Look at the mirror at yourself flat. Most people don't like how they look flat. If you want to like how you look, simple formula for that, looking in the mirror, put a smile on your face and it feels better, it looks better. People will laugh at you, say, that's silly, why are you smiling at yourself in the mirror? When we look good, it gives us more confidence, that's correct. So I bring the brow up and I massage across the brow through here. Okay. Now I'm going to do some in the temple as well. Everything's looking good. Feel a little bit of a pinch there?
Mm-hmm.
Twist technique, I'm holding the tissues. I'm going to do a little bit of that hydrodissection, and I can see the product there, then I'll massage that through, and that product then opens the subcutaneous tissue plane just a little bit, makes it a little bit easier for me to advance the cannula atraumatically and try not to disrupt the blood vessel. Pressure pinch. You feel a little bit of a pinch here? Not too bad? A little bit? Okay. Another thumbs up. We like the thumbs up. Now, even though I've injected about half of it, that's about 4/10 of a cc. I'll massage it to flatten it out and do some hydrodissection, and then firm pressure. I like to have the patients do it. Hello, Teresa. Good to see you. Everything's looking good. Thank you for tuning in. If you're just now joining, check us out at imagelift.com. People ask for pricing on this. Go to imagelift.com/pricing, and you can use our price estimator. We take virtual consultations. You can send us your photos. So now we've done the temples, we've done the brow, and we've done some of the submalar region and around the mouth. So we did, and we've got here. That's perfect. So now I reassess, and I'm going to have you turn your head this way and just look straight ahead as if you're talking to someone. So raise your eyebrows up real high. So the brows won't move up because we numbed here. So the brows will come back, I promise. But we've done some fill across here. We did some fill in the temple. And I may do just a little touch more in the temple. But what I'm going to do now is the back of the jawline. Okay? So I'm going to turn your head to this side. That's perfect. And we'll do the back of the jaw. Do you feel a little bit of a pinch here? Not too bad?
No.
So that's the insertion point for the cannula. Very good. And then I'll find, you press and you just make that little tiny blood spot where the insertion point is, insert the cannula. And then once you're there, sorry, a little bit of a pinch. Twisting while I'm holding the tissues, twist to atraumatically advance as atraumatically as possible. Pressure pinch, and once we're at the point, you can see the tip of the cannula is right here. Shiver technique to inject fine amounts, and then I will advance ever so slightly. Heather, are you doing okay, dear?
Yeah.
Very good. Everything's looking good.
Hello from France.
Hello from France. Bonjour. Thank you for joining. Please let us know where you're tuning in from. Are you in the United States? Are you international? Everything's looking good. We'll build a little bit back here through the jawline. We never think about the back of the jawline, but look at your photos in your 20s or 30s, and then you'll see how full we are, and we lose that volume. Some people say we're full, some say we're full of it when we're younger, but we're full, more full when we're younger, and we lose that, so now we're just making up. We lose bone as we get older, and we get a little shorter. So now we're just putting things back where they already were. So let me check my little cannula here. Can you give me another cannula, please? Thank you. I'll change the cannula every now and then just to make sure we got good flow. Do you have one there? Thanks. Okay. Everything's looking good. So I'm just switching my cannula. Sometimes the cannula can get a little bit congested with the product, so then what we do is I will actually clear the cannula or just entirely replace the cannula. And it takes me just a moment to do all the little behind the scenes things that we do to make sure we get a good filler result. Let me just test this one here and just see that it's doing fine. And then I'll even flush the cannula just a little bit. Yeah, I'll need a new cannula. Thank you so much. Okay, so perfect. So if we need to switch the cannula, then we just switch that out. Pressure pinch, pressure pinch. Do you feel a little bit of a pinch there, Heather? Not so much now?
No, not now.
So once it's numbed a bit, then you don't really feel so much. So I'm just spreading it. As you can see, shiver technique, many different directions, fanning technique. Okay. The dynamic movement of the shiver technique allows a fine dispersal of the product, and it allows it makes it very difficult to be in a blood vessel and inject, which you absolutely don't want to do. Hello Cindy, hello Michelle, thanks for joining in. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. Let me turn your head this way. You can check out our books. Do you feel a little bit of a pinch here? Not too bad?
Little.
Okay. You can check out our books on Amazon. We guarantee we can make you look younger in the Smile Prescription. We will be speaking later in Phoenix in November and in Miami in October, training about how we do our live videos and how we do our filler technique. So now that I've placed the cannula, I use the twist, 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 and a little bit of the left hand in this angle. I just shiver technique to use this very small amount. It's about 1/10 of a cc there. I'll use both of my hands to place and twist through here, or then sometimes what I'll do is I'll reach over. And now I'm using my right hand to just variable. Sometimes, obviously I'm more of a predominant injector with my right hand, but it is convenient sometimes to use the left. Surgically, I'll use both left and right depending on what I'm doing. Little pressure pinch there, not too bad. And when you first inject, you may even see a little bit of the product or a little bulging in the skin, and you just massage that down, and that does go down. You want to make sure that that you massage that very well, and you also just disseminate a very small amount of the product. So we're very proud to share what we do with our fillers. Fillers are the future of facial plastic surgery because there's no downtime. And the most expensive fillers are the temporary because we have to keep replacing them. Perfect. Now with the last little bit, I'm going to turn your head this way just a bit more. With the last little bit, I'm going to do just a touch more in the temples because she's a little bit more hollow there. So everything's looking good. Hello Maurice, thanks for joining in. Heather, how are you feeling, dear?
Good.
Very good. We're going to do a little bit more of the filler, and then we're going to do the lip plumper for the creases, and then you're done. I'm going to turn your head this way a bit. So we're going to do a little more. Now at this point, she'll probably feel very little. Do you feel any in the temple? Do you feel any pinching there?
No.
Because we've already numbed with some of the product. So I like my twist technique, twist to place and shiver to inject. And then I can even feel the pocket because now the product has hydrodissected in the subcutaneous plane. Some people say below the superficial temporal fascia is the safest place to inject, and while I certainly won't argue with that, what I will say it's very difficult to reliably and consistently get into that plane. So I think a more practical approach is subcutaneous, hydrodissection, twist technique, gentle feather touch technique. Very good. If you get a fluid collection in the temple, you can just hold some pressure. I like to do firm massage, up, down, side to side, back and forth. This is thank you Maurice, this is Bellafill, and people say, can you develop a sensitivity to Bellafill? There's this collagen skin test. I've not seen someone develop a sensitivity to Bellafill, but you can certainly potentially develop a sensitivity to anything. Thank you for tuning in. Everything's looking good. Let me turn your head this way. And for those of you that were asking about pricing, you can always go to our site and look up imagelift.com/pricing. Let us know if you are interested in a virtual consultation. You can email us your photos. We have patients that come from all around the country internationally to have our treatments done, so we're very proud of our patients and we're proud of our teaching. So I'm going to do a little bit more of massage in this area. Heather, how are you feeling, dear?
Good.
I'm going to turn your head to the side. So we did a syringe through here, here, one through this area, one, and then we split up between the temples and the brow. So we did 7 total of the Bellafill. Now what I'm going to do is, this is some of the Bellatero. Now we've already numbed the lips, okay? And so what I start with, because she was most focused on the creases, so this is the Bellatero, okay? And what I like to do, I don't know if you can see that on the video there, but I like to prime. You can see just a little tiny bit of that little blob on there on the tip, and that's just right at the tip, which means the needle is primed. And then I just find, do you feel a little bit of a pinch here or not really?
No.
So then you're subcutaneous, so I'm doing a little bolus injection. Let me see if I can do that. Right into the dermis as much as possible. A little pinch through here. And you may even create a tiny, tiny little bit of a bulge, but you can flatten that out. But I'm really just trying to reinflate. I call it reinflating. So I'm going to grab that's a deeper wrinkle, and let's see how much we can fill that. We can't make it perfect. We make it as good as we can. Little pinch. And then with the rest we'll use to plump the lips. Heather, how are you doing, dear?
Good, good.
Right through that crease. We go right into the crease. And when you're right into the dermis as best you can, that's almost 1/2 of a 1/10 of a cc. Now, sometimes patients will come back for 2nd or 3rd treatment with hyaluronic acid because you can continue to improve it over time. Thank you for watching. Let me turn your head this way just a little bit. So you find the crease, we're right into the skin, and you may see a little bit of the product, or sometimes you'll see some blanching.
What is this product called?
This is Bellatero. It's hyaluronic acid. It is a reversible filler. Hyaluronic acid really is excellent for fine creases. Sometimes Bellafill can treat some of these creases, but the FDA recommends not to use the Bellafill in the lip because, I believe, because you higher risk of forming nodule. But I've had patients ask for it there and successfully treat it there. But some patients say they don't want to bother with, dealing with a nodule in the lip. So that way patients know their options. I think it's certainly a better choice than silicone, which is also an option. Hello, Jeffrey. Thank you for joining in. Everything's looking good. For those of you just joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We had our 3 surgeries yesterday, and today we're doing some facial fillers and our follow-ups. Heather, how are you doing so far, dear?
Good.
Now that I've done some of those little creases, the rest I'm going to do, I'm just going to plump the lips just a bit. So I like to do just a very superficial, just along the lip line, just a small little 1/10 of a cc for each lip, very small amount. You feel a little pinch there, not too bad?
No.
Everything's looking good. We try and make it easier than getting a tattoo. Very good. So you will look natural. I don't like the overdone lips. That is a problem, I believe, in today's culture. But if someone wants it and they want to do it, that's fine. I discourage my patients from doing that. And I could even see it just fill through that area. You can go back on the video and see how you see the reinflation of the skin. So now we've injected just a little plumping, and if they want more, we can always come back. Very good. So when you're using the needle, you see those little tiny blood spots, but we can mop those up, and they sometimes take a little bit longer to resolve. So this is the best way, I believe, to do fillers. It's comfortable. It looks natural. There's no downtime. Fillers truly are the future And when you're using small amounts superficial, even if you do get into a blood vessel, you're using such a small amount that it's not going to make that big of a deal. So, perfect. And then I'll just do a little outline of the philtrum here. Perfect. You feel a little pinch there? Not really?
No.
And I'll do a little withdrawal. Just a small amount to reshape the Cupid's bow. And the lips can get the little tiny blood drops there. That does happen a little more so in the lips because they're very vascular in the lips. So right in the philtrum here, a little plumping, and then we'll do just a little bit of a plump in the lower lip superficially, small amount. Perfect. A little bit for the upper lip. Perfection is dangerous in plastic surgery. If you're a perfectionist, now don't get me wrong, I have very high standards, but if you're too hard on yourself, too hypercritical, you are tempted to choose a treatment that goes too far. And that's my job, that I protect you from that. But the other risk is you may do a treatment, get a great result, and you're still not happy because your standards are so high. So, all right, we're completely done with the injections, and then of course the lips do have just a tiny bit of bleeding that they do. So what I'm going to do now, why don't you take a look in the mirror. So Heather, can you see how it fills in around the mouth and the cheeks? How does it look so far?
Looks good.
Looks natural. We're not overdone. Okay, your smile will come back, I promise, because we've got the numbness that causes a little bit of the difficulty in smiling.
Is this painful?
Heather, did you have much pain through the procedure?
No.
Heather says no, and I believe
No, it was very good. Only just 1 or 2
yeah, we'll blot for you here.
inches.
So now when you see Heather there, hello Eric, good to see you. And here was her before, where she looked great before. Now we're just doing a little bit of a refresh. So here's her before pictures. Through here you can see the hollows, we fill those areas in. And here we are after.
Wow.
Let's bring that, can you see the difference there? I'll do that one.
Mm-hmm.
Hold the mirror down for just one moment so you can see. Here she is. Yes, she is numb. And then here's the before. Okay, so you see a little bit of hollows, especially in the temples. And then I'm going to have you turn your head to the side. That's perfect. And then turn to the other side. So she will absolutely pass the grocery store test today. So we are all done for today. Let me zoom back out. And thank you all for joining in. Hello, Misty. And please follow us on YouTube and on Facebook, facebook.com/ImageLift. We'll have more videos to come soon. So thank you for watching. Bye. Look us up. Image Lift.
Oh, that's because it's
A little bit
numb?
of swelling and it's numb in that area, so
Alright.
that's going to come right back up. Very good.